Assalamu alaikum, hello and welcome to yet another special episode of Health Show Live Surgery here only on the Islam channel. Now, if you're tuning in for the report, the show will be scheduled for a little bit later this evening at 10 p.m, so you'll still be updated on all the news for today. Now, so far in the series, we've brought you live laser eye surgery and ankle surgery. And this time, though, we thought we would focus on a slightly different kind of condition, which a lot of people suffer from, especially men, and that's hair loss. But before we reveal any more, let's have a quick recap of our last show, which was on ankle surgery. Now, we're going to be learning about some of the underlying causes of foot and ankle problems and what you can do to help prevent them. Is it maybe just as simple as a change in footwear? Well, here in the studio with us is our live studio audience who will get to witness, along with you at home, a tarsal coalition resection surgery.
So you can tell this is live, it's not edited.
Absolutely. Well, that's one of the things we wanted to do, so people would see it, literally, the whole process. Yeah. So a lot of this is a case of when you get there, that's when you're actually making a lot of the decision making.
Yeah, I think you remain calm, you have a plan in your head, but you've got to be prepared to deviate from your plan as and when required. And I think, that's...
So at this stage, you've obviously realised you've got to take a little bit more off.
I've realised I've taken the bottom bit out, which is the main lump, and now I'm going to take more of it from the top as well.
I want to come back to Mohsen, who's actually he's sat there all the way through with a big grin on his face, which I guess is a good sign.
Not so friendly language.
What are you thinking watching as these chunks of your bone are being removed? Wasn't that amazing? I mean, it was literally just like watching a jigsaw puzzle where literally piece by piece everything is corrected and then put back together again. And it really required some intricate and expert surgery. So thanks again to Mr. Nazir and all of his team. And if you'd like to find out more about foot and ankle issues, then please do email us on healthshow@islamchannel.tv. Now, on with tonight's show. Now, many men, and for that matter women too, suffer from hair loss, either from a receding hairline or from on top of the head. And for anyone affected by this condition, it can be a bit of a nightmare that can turn into depression as well as a loss of confidence. Now, once again, here in the studio, we have our audience with us, and along with you at home, you're going to get to watch a direct hair implantation surgery. And with us is Dr. Zuba Bagassi, who's a consultant for the hair transplant procedure and clinical director at the Synergy Hair Transplant Clinic. Now, Dr. Bagassi will talk us through the procedure and answer your questions too. And we'll also hear from a patient who's had a successful procedure and hear their thoughts. But first, let's find out a bit more about the Synergy Hair Transplant Clinic based in Blackpool in the north of England.
DHI has been the world's leader since the 1970s. They've been going for 45 years. They've provided patented techniques and solutions for hair restoration. They have also trained over 200 surgeons and treated over 200,000 patients worldwide. So not only does that give me confidence that it's a company that gives great service and clinical results, but it gives me great pleasure to work with them because it offers me a synergistic vision for what we offer to our patients, not just for dentistry, but for hair transplantation as well. The type of patients that we see also are young adults, ranging from their 25 to 30-year-olds. We have patients that are more into their 50s and their 60s. In fact, we've even had patients into their 70s. And they come from mixed ethnicities, they come from mixed backgrounds.
The medical team arrives at the clinic earlier in order to do the preparation of the operation room and have a look at the file of the patient and his whole profile. If we talk about an average, it would be like a 4 or 5 hours procedure, like a regular session, in which at the first part we do the extraction. We have all the hairs we need for the restoration, then we have to do a lunch break, and then we proceed with implantation. During the whole procedure, of course, the patient is awake, we can talk, or most of the times they feel very relaxed when we start and see how things are.
So the success very much depends on the type of surgery that is performed. The type of surgery is where an individual graft is taken out from the donor area and then implanted without an initial incision into the recipient area. So for instance, imagine a plant pot. A plant pot is taken out from the roots and then implanted into the soil without any pre-surgery. So the healing is very natural healing, and there's no or very little disruption to the blood supply. This is what happens with the DHI technique. Bearing in mind that DHI technique can only be undertaken by DHI Global and DHI clinics worldwide, as it's a patented technology and patented technique. The FUE technique requires an initial incision made for your hair, the graft, or the plant pot to be placed in position. Well, what does that mean? What that means is that the healing occurs via scarring. And when it occurs via scarring, it disrupts the blood vessels. And when it does that, the success rate of the graft is affected. The success rate for a normal, typical FUE technique, which is, again, to reiterate, all the other clinics worldwide, apart from DHI, undertake this technique, has got around 50% success rate. So for every 100 grafts that are taken out and implanted, 50 of them will survive. With the DHI technique, the success rate for a graft surviving is over 90%. Once the graft heals, and once the graft is implanted and the body allows it to heal, the success of that graft is 100%. So that will last you for the rest of your life.
So I'm sure, like me, having seen that clip, we feel like we know a little bit more now about what a hair transplant clinic does and what it has to offer. And I particularly liked the plant pot analogy. And Dr. Bagassi, you're with us now. First of all, welcome. Thanks for joining us.
Thank you very much for inviting me.
Now, I noticed there that you're actually based in a dental clinic. You better explain what the connection is between the two.
Well, patients attend our clinics to solve a problem for them, and often this problem relates to their confidence. Now, we provide dental services from cosmetic dental makeovers to dental implants, sedation for nervous patients, and we've over time evolved to provide more facial aesthetic treatments, Botox, fillers, thread lift treatments. But there was something missing, and that thing that was missing was the hair. Now we can give a patient their confidence back by not just providing dental services, but to artistically design their teeth, their face, and now their hair as well. So it's a full package.
So how did you wind up having a relationship with DHI? But there's obviously a lot of different, as we heard in the clip, there's a lot of different treatments out there. Why DHI?
If you want to buy a handbag, ladies would buy Chanel. And if you want to buy a car, men would buy Mercedes. If you want a hair transplant, you would want DHI. And certainly, I would want to affiliate myself with an organisation that are the world's leaders in hair transplant surgery.
So how did you find out that they were the world leaders, and what was it about what they do that gave you that confidence to work with them?
Well, DHI have been performing hair transplant surgery since the 1970s. In fact, just last year, they were the 45th year anniversary. In 2002, they introduced a technique that they introduced to the rest of the world. And in 2006, they introduced a fresher technique, a patented technique that only DHI can perform. Now,
And this is what we're going to see later on
and
this
this is
evening.
exactly what you're going
Right.
to see today.
So that particular patented technique that we're going to see later on this evening, that's something that only DHI can do, nobody else can do?
It's a patent across the world, across the globe. And it's only DHI surgeons that are registered to provide the DHI technique. And it's not just the technique that's patented, it's actually the tools that are used that are patented as well.
And what did you have to do to convince them to allow you to perform this surgery? Because I can imagine when it's something so popular and so successful, there's going to be a lot of people vying for that business.
Absolutely. So worldwide, currently DHI have 56 clinics, and they are based in the world's major cities of the world. Okay, and it took me at least a year and a half or so to show that the dental services, the award-winning dental services that we provide, match up to the DHI services that are provided worldwide, and it's a synergistic effect.
Let's talk about hair loss itself. And a few, maybe we can sort of do a bit of debunking of myths here. You
Absolutely.
know, when does hair loss start? Is there any typical profile of individual who has it? And that kind of thing. Because I know we're going to talk later on about some of the preventions and some of the things you can maybe slow down the process.
Sure.
Tell us a little bit about the concept of hair loss. Why do we lose our hair?
Well, the most common cause of hair loss is genetics. And our hair, our genes are coded to ultimately lose hair. Now, some people lose hair at an earlier stage and some people lose hair at a later stage. So it's mainly related to genetics. Hormones play a big role in this. There are other causes of hair loss, such as other forms of alopecia, such as scleroderma or lichen planus, which is more connective tissue disorders, Down syndrome, thyroid issues, diabetes, stress and psychological issues. So there's a whole host of different etiologies or causes of hair loss.
Well, however that hair loss manifests itself, obviously to that individual, it's truly personal. And actually, if you now have made that bold decision, sorry, excuse the pun there, but you've decided to go for hair transplant surgery, what thoughts would be running through your mind? Well, let's find out from a patient who's actually had the surgery and see how they're doing in their recovery 3 months afterwards.
Found out about DHI on the internet, basically. I was just looking and spent hours and hours looking at various different places and different methods, and DHI just seemed to tick every single box for me. And the fact that it was only 10 minutes away from where I live was perfect. It was basically the method. It just seemed perfect for what I wanted. No scarring, you know, no cutting involved. Just seemed spot on. I'm very, very excited. Hopefully the results will be well worth it. And I'm generally just excited to have it done. I'm very surprised about how relaxed I am today, in all fairness. I was a bit apprehensive last night when I went to bed, but I woke up this morning, felt great. Driving here, didn't feel any nerves, and I expected the nerves to kick in when I got here, but quite the opposite. I think these guys know what they're doing, very, very professional, and I think in this time, in 12 months' time, hopefully I'll have a good set of hair. Basically taking, I think he said, roughly around 3,000 hairs that he's just taken out, which will be basically put in. He's going to draw a line on my head and show me whereabouts it's all going to go. And yeah, it'll take him about 3 hours, I guess. And yeah, it should be brilliant. Basically pretty much dead on 3 months, what you see now from when I came here. Yeah, it wasn't that sore at all. I was really shocked. I expected it to be very painful in the shower, but it wasn't.
and which would have been 2 weeks, he'd never ever know I'd had anything done. You know, incredible. And it has genuinely given me a serious boost. Yeah, just talking to people and just, well, you can't help but glancing and seeing your reflection and looking in mirrors, and it's just certain lights obviously are different. If it's very bright light, if it's a bit dimmer, you can properly see a hairline, and it's just great. It's just a real buzz.
Wasn't that great to actually see it in action and to be able to follow a patient's journey from that pre-surgery part all the way through to post-surgery? And certainly when you saw the results there after just 3 months, truly amazing. And our patient there, Dr. Bagassi, was actually clearly very impressed. Let's talk a little bit about the process and the procedure.
Sure.
Is it suitable for everybody, first of all?
Well, a thorough evaluation, a thorough assessment is so important. Before a treatment plan for a hair transplant is actually agreed, the diagnoses must be first of all come to. So hair loss can occur for a number of reasons, like I explained earlier, and hair transplantation isn't always the only solution.
Actually, we'll come to that in a while, actually, because as you quite rightly say, there's other things that you can do. First thing we need to establish is that hair that he has now got, that's actually growing hair.
Oh, absolutely.
And it's real hair that's actually growing.
Absolutely. So the hair is actually taken from the back of the head, called the donor zone, and each graft is intricately taken out and artistically positioned in your recipient zone, which is your area of hair loss.
Now, you talked in the first video about the plant pot.
Yes.
And how you sort of moved it. And I'm guessing that's the patented part. Can you talk us through that and what makes this procedure different to any other kind of procedure?
Okay, so the DHI technique that was introduced uses specific implanters to actually implant the graft, the plant pot, into the area where you've got the hair loss without a pre-incision, which is the key here.
So is DHI the only technique where there's no pre-incision?
Absolutely, and this is the patent. The technique is the patent is within the technique and within the implanters itself. The implanters carry the individual graft and it gives it the appropriate depth and angulation. And angulation is important because if my hair is going this way, I want to ensure that my hair, my new hair, is always also growing that way as well.
I mean, it's amazing to watch. And the donor area, because it seems that the hair, as you said, always comes from the same part.
Yes.
So that donor area, how sure can you be that that area is an area that's not going to be a hair loss area in the future?
But genetically, the back of the head and the sides of the head, the grafts that are present there, they do not suffer from hair loss. So once the grafts are taken out and implanted into the area of hair loss, there will be 100% guarantee that that graft will not fall out, so long as there's no other adverse medical conditions that may appear further down the line.
And what about after the procedure? We saw there 3 months afterwards. How often do you see the patient afterwards, and what's the sort of follow-up system?
Aftercare is crucial in any surgery, whether it be a surgery to your knee or your eye or your nose. Aftercare protocol must be adhered to, because if the patient isn't reviewed on a regular basis, and we see patients initially for the first 2 weeks, and in 3 months, every 3 months for the first 12 months, so early signs of things not working out could be spotted and treated. Okay.
OK, well, we're going to talk a lot more in a while. I mean, it's fascinating. The more we talk, the more we actually realise there's more questions. So we're going to be talking to him more later on in the show as he guides us through the surgery. But right now, we're going to take a break, so please don't go away. Welcome back to another special health show, Live Surgery. Now tonight we're bringing you a direct hair implantation surgery, and guiding us through the whole procedure is Dr. Bagassi from the Synergy Hair Transplant Clinic, which specialises in bespoke hair transplant services. Now the surgery itself can last anywhere between 3 to 5 hours, but you'll be delighted to hear that we've managed to actually condense that, so you're still able to see exactly what happens and what goes on during the whole hair transplant procedure. Now, we should say that this is a surgical procedure, so we would like to remind our viewers that they need to be aware that there may be some very small traces of blood, which some of you may find a little bit disturbing. So let's now have a little look at the video itself, which should be playing any moment. And we're basically just going to see this whole procedure. So maybe you can tell us what's happening here. What's the cream she's putting on and why is she doing that?
Okay, so the gentleman has had his hair shaved off, and the cream that's been put on is actually a form of dye that's actually dyeing the hair itself to be able to visually see the follicles that needs to be extracted more clearly.
Oh, really? Right. Okay. So if you've got fair hair, you're going to need to dye it effectively. Yeah.
The surgeons actually work under microscope. Having a hair dye that's with ivory hair makes the job a lot easier and a lot better.
And what is you've shaved off the hair, but you've left obviously a small bit. How much have you left on there?
A number one.
Right.
It allows the extractors to know exactly where the hair follicle is above the skin, to be able to extract the individual graft.
Okay, and what's the first thing that now what would you call her? Is she the practitioner? What would you call the person who's actually doing the surgery itself?
The surgeon,
okay.
The DHI surgeon, and what she's currently doing is again disinfecting the area where the grafts are to be taken out. And just to reduce the level of infection, the patient's been draped up appropriately. Precautions are taken to minimise the risk of infection during and after the procedure.
And what are these lines that she's drawing? What are they for?
Okay, so hair transplantation is an art. It's an art form. And bearing in mind that when an individual graft is taken out, that graft will never ever grow back. So your lifetime supply is where you're going to give your grafts from. So it's important to actually calculate how many grafts you've got to give, and then from what you've got to give, you can only give a proportion of that. Otherwise, what you'll find is that you lose too much hair from the back.
So this is basically to make sure that it's taken selectively.
Absolutely, and the best grafts are selected.
Okay, and what's happening now?
Okay, so at this stage, there's saline that's actually put into the head, and can you see the rise of the actual the epidermis, the skin layer where the grafts will be taken out from. The grafts are actually within the dermis layer, but if you lift the skin up, it allows the grafts to be taken out easier. She will also be then injecting local anaesthetic into the area to numb the area up.
But the patient is going to stay awake throughout the whole procedure?
Oh, absolutely. The patient, again, is fully awake right now. And what you'll feel, what the patient feels, is little scratches. And I can assure you, this is probably the most uncomfortable part of the whole procedure and the whole experience.
Well, he doesn't seem to be flinching too much, so I'm guessing it's not that uncomfortable.
I'm glad you noticed that.
Now, what about the actual training for your DHI surgeons? How long does it take? What would their background be? And then how long does it take them to train up to become fully qualified? Okay,
so worldwide, DHI have a DHI training academy that train the DHI surgeons. The background is normally in dermatology. So these are plastic surgeons specialised in dermatology. Within the UK, the surgeons that perform the surgeries within the UK, they are all GMC registered as well. So they are appropriately vetted, appropriately trained, and follow the CQC guidelines within the UK.
So within your clinic, you've got dental, you've got... Well, tell us just roughly what you do, because there's so many different elements to how you're able to help people's well-being.
We provide confidence. And to provide confidence, we need to structure together a plan that includes not just your dental health, but your facial aesthetics and your hair rejuvenation as well. So it's a full package that we provide.
And every individual being an expert at what they do.
Absolutely.
And
yeah.
how many staff do you have then? How big a team are you?
Oh, we've got over 50 staff members.
Wow.
We've got clinics based in the West Midlands, all the way through to Lancashire, Greater Manchester. And we have we undertake a lot of training and select the appropriate skilled staff to provide the services.
So right now we're seeing the continuation of the local anaesthetic being
Yes.
applied, and the surgeon there has an assistant who I see is kind of like setting everything up each time.
Everyone needs an assistant. Even the producers of the show needs an assistant. And without the hard work of the assistants, nothing will come to fruition. And the assistant is there to support the role for the surgeon.
Now, has she actually starting, or what's taking place at the moment?
Okay, so currently what she's doing is she's carefully selecting grafts through the microscope, which are used for the transplantation procedure. So she's harvesting the grafts from the areas that she's actually calculated, she's designed for where she's going to take the grafts from.
So they're all stored in this sort of pen-like device, are they?
No, so she's actually making little punches within the around the graft, so that when she comes to collect these grafts, she'll collect a dozen grafts at a time. So at this moment in time, the grafts are almost released from the dermis layer, and then she'll get the appropriate tool to be able to take these out and then store ready for the implantation process.
Okay, so we'll let the audience and everyone at home into a little bit of a secret now, because
Sure.
you've actually undergone the procedure yourself, haven't you?
Absolutely.
And at which point everyone now looks at your
Yes.
hairline to see how good it is.
So, I mean, I can ask the audience a quick question, and I'll ask the audience where and when. When do you think I had the actual hair transplantation procedure?
4 years ago we've got in the front. Yeah, okay. Anybody else?
Any higher or lower bidders?
Hi, hello. Don't turn this into a game show now. Okay. So, any other ideas? How many?
7 years.
7 years.
Good, okay.
So how long ago did you have it done?
4 months ago. Okay.
Wow.
So I had my treatment just over 4 months ago.
And whereabouts, where was the implant?
So the implantation was achieved on my horns on my front hairline, and also on the crown area. And the full result isn't actually achieved just yet. You've got to give it a full 12 months to actually achieve the full result, for the hairs to grow thicker and more bolder. Okay.
And when it comes to confidence, do you think a lot of the confidence is actually boosted when people actually know they're going to go through this procedure? So it's almost before the procedure begins, people actually almost anticipate feeling better.
And I can absolutely agree with that. In any surgical procedure we perform, whether it be dental rejuvenation or facial aesthetics or hair transplantation, when we initially agree on a treatment plan, you see the spark in the patient's eye. And you see that, yes, they're going to have this treatment done. And because it's the right thing for them. And once it's the right thing, it's like buying a house or buying a car. You start feeling the pleasure of having a nice house or having a nice car the moment you decided that you're going to buy a nice house or a nice car.
Well, we're going to actually involve our audience here because they've been sat very patiently waiting. And has anybody got the microphone? We have just over here. So far away.
Who has the first question?
Okay, anybody got a question? Okay.
Did you ever experience in any of your patients any side effect?
Okay, so in hair transplantation, the biggest side effect generally is one of scarring. Within DHI, there is no scarring. And we have gone away from these scar techniques that are still currently provided today. The answer to your question is that the main side effect that, if any, that happens would be one of slight itchiness for a few weeks after the procedure, redness for a few weeks after the procedure, and this is normal for any surgery that you have.
We'll just go back to the video here a second, because I think we're at a different stage. Perhaps you could explain what's actually happening now.
Okay, so the punches that were taking place before, where the hair graft were able to be dislodged from the dermis layer, what the surgeon is now doing is carefully selecting the grafts out of the dermis layer, and she's collecting it ready for the implantation.
Wow, okay. So coming back to your personal experience, the hair itself, does it grow at the same rate as your other hair? So in the area where you've implanted it, will it be the same?
Absolutely. So if I take the hair from the back of my head, the growth rate would be the same as what it would be for the back of the head. The hair cycle goes into 3 separate cycles, an anagen and a catagen and a telogen phase. And the new hairs that grow also follow the same cycle. However, if you were to take hairs from the chest, because you don't have enough hair on the back of the donor area to give, then the rate of hair growth will be different.
We'll just go back quickly, because we'll come back to that, because that's quite interesting, the idea of taking hair from somewhere else. But our patient is now sat up, so what's happening now?
Okay, so the surgeon has already agreed on a hairline with the patient. The patient had brought in some pictures that they want to aspire to be. Normally, the patient, when they were a little bit younger, when they had more hair, and what the surgeon's doing is she's artistically designing the hairline. Now, what we often get is we get patients that come into the clinics and they say, look, I want my hairline to be just above my eyebrows. Well, DHI won't do that because it's not natural.
That would look a bit peculiar, wouldn't it?
It would look really strange. And you see patients that have had this sort of hairline or a flat hairline. Nature doesn't give you a flat hairline. And what's important here is to give you an aesthetically driven hairline.
Because I think that might be one of the things, I don't know if it's anyone here in the studio audience has thought of this, but sometimes when you see, which we have, let's be honest, all seen, a poor job of it, and you think, hang on a second, I don't want to look like that.
Absolutely, and we have patients, we see day in, day out, week in, week out, and we have patients that have had treatments done, the FUE treatments or the strip treatments, and they come for us for corrective surgery because there's no other provider or technique more superior to the DHI. My answer to that is, well, why have it in the first place?
Yeah. Well, we see, I think we're possibly going to the next stage of the procedure. Our patient, again, he looks very calm on his back there, just waiting. And again, this particular procedure, I think, was about 4 hours or so, I think.
About 4 hours, 4 hours, 2 hours for the, about an hour and a half, sorry, for the extraction. Then we have a lunch break, which we provide, and then the implantation phase, which is what you're currently seeing right now.
Okay, so this obviously is possibly for most of us the most interesting part to actually see going in. So again, just defining the area, I guess. And is this more of an anaesthetic in the front area?
Again, more, it's a mixture of both anaesthetic at one point and then saline, which is to bulb out the skin, just to lift the skin slightly to allow the hair grafts to be implanted appropriately.
Okay, so that again will be done all the way along the hairline where it's going to go.
Yes, sure.
Let's talk very briefly about what happens afterwards, because obviously if you do this fairly earlier on when your hair is starting to recede, obviously people are thinking, well, hang on a second, am I going to have to come back in 6 months' time as the next section's receded and gone? How can I deal with that situation without having to keep on having operations all the time?
Okay, so hair loss is normally genetically driven. So when you've lost hair, your other hairs, which is mainly towards the front, the middle and the top, will be genetically coded to be lost as well. There are treatments and medications and certain techniques that can be used to reduce that rate right down or to delay that process. Now, there's some products such as Regain products, finasteride, which is another product which is used, which has effects on your
So those kind of products do actually work?
They delay the process of the hair loss taking effect tomorrow. However, as soon as you stop taking these products, the hair loss would have been the same as if you hadn't have took the products. There is another solution for this, over and beyond healthy eating and a healthy lifestyle and a less stressful lifestyle, which is PRP techniques. And what this is we draw the actual blood from your arm, from your hand. We centrifuge it and we obtain the platelet plasma from the actual blood source, and we re-inject that back into the area of growth that's required, or within your existing hair. And what that does is it allows your existing hair to become thicker, to become stronger, and hence to prevent or delay the process of hair loss in a natural way.
I mean, we could talk all night about that. It's fascinating.
Yes.
We're going to come to segment because I can see the implantation is just coming, but I just want to take a couple more questions from the audience, and we'll come back to the actual implantation process. So, who else has got a question? Okay, just down here at the front.
Hello there.
Hi.
Have you encountered any patients who might have had longer side effects or permanent, and have you fixed them or?
Absolutely.
rectified
I
them?
mean, we come across such patients every day. And these patients have had the older techniques where they come in with big scars and they come in with the donor zone which is affected, damaged. Remember, this is your lifetime worth and you do not want to damage the area. With the DHI technique, absolutely not.
So let's come back. We'll have a couple more questions in a moment, but I think this is the crucial part, which is the implantation. Talk us through exactly what's going on, because you said this was the bit that had been patented.
Absolutely. So the patent belongs to not just the technique, but also to the instruments that are used. The instruments that are used are less than 1 millimeter in diameter. What it does is that it holds the actual graft, and without a pre-incision, so you can see that the surgeon isn't actually making a little hole in the scalp area, the recipient zone, prior to placing that graft in, which is what all the other techniques actually do. The implanter itself can place the graft in the exact depth within the dermis layer, which allows the optimal healing. And not only that, it can also place the graft in the right angulation, which is the key for an artistic design.
So the hair actually
grows in
the right direction.
Absolutely.
Okay, so very quickly, but I think that's going to be carrying on for a little bit longer. Have we got any other questions anybody wants to ask? Yeah?
Yes, my question is that during the process in which you're diagnosing the patient and determining whether or not they're viable or suitable for the procedure, have you ever encountered any medical conditions that they've had which meant that they can't have the procedure done for them?
Absolutely. I mean, you saw just a few minutes ago when a member of the audience asked me about their hair loss. And the diagnosis was one which hair transplantation wasn't the answer to, wasn't the solution. And we come across this every day. And the diagnosis is so important. There are causes of hair loss that hair transplantation will not treat. And there are medications and there are preventative measures that you must adopt to be able to have the optimal results.
Just want to have a quick look. We'll come back to questions in a moment, but this looks like the process where the assistant is loading the needle. Talk about that. Tell us
so the
what's
graft
happening.
is individually loaded into the implanter, which is then used to implant into the area of the hair loss.
And again, that's all part of the patented process.
Yes.
And I see the patient there. We can actually see his face. And he's, again, very calm, looking around.
Very
so he'll
relaxed.
just experience some numbness and that's about it.
The anaesthetic will work for 2 to 3 hours post-procedure. And then the patient will, the anaesthetic will wear off and he'll go about his normal duties. Normally, patients can go back to work the next day. There is no stitching involved. There is no big chunks of skin that's removed.
I mean, it's very non-invasive, really,
Very
isn't it?
non-invasive. It's a very intricate, artistic procedure.
Excellent. OK, another question. Got time for just one more question from our audience. So we got one? Yep, over here. We're just going to get the microphone over to you. And because actually hearing from a lady as well, because it's obviously hair loss, we associate it with men, but of course ladies do experience it too.
Oh, absolutely, absolutely.
I just wanted to know, once the procedure's done and the process of healing begins, are there certain things that they can't do, such as washing their hair or maybe going swimming or something like that, or there's certain things they can't do?
Absolutely. So the aftercare and the protocol that must be adhered to after any surgery is very important. So after hair transplantation, one mustn't wear a hat straight away, because the follicles, the grafts that are implanted into the fresh zones, they need to heal and they need to connect with your own skin and your own the areas that you've placed the grafts into. So by putting a hat on or by wearing clothes that you have to put over your head, they may disturb the grafts. So it's important that such advices are followed.
Things how like long is that for? How long would you have to be careful for?
For a few days for the initial healing to take effect. But regards to sports, we advise at least 2 weeks, and some more physical forms of sports, heavy lifting, we advise for 4 weeks.
I mean, it's amazing to hear the whole process. And when will you sort of effectively finish with a client and say, right, that's it, it's on its way, you don't need to come back?
Oh, it's a lifelong journey.
Right.
It's absolutely a lifelong journey, and that's why going abroad to save on a few bucks isn't the solution, because hair loss is a lifelong condition, and if your hair loss isn't managed by a clinic for the rest of your life, it's like having diabetes, or it's like having any other chronic condition. Hair loss will occur for the rest of your life, and to manage that is very important.
So we're just coming towards the end of our video here, and again, it's just continuing with that sort of same process. And it's amazing when you think of the other procedures which might involve more blood. You've just got a tiny little dabber there, and that's it.
Absolutely. And the key to this is the non-invasive nature of the procedure itself. The hair implants are placed within a specific zone within the skin. There's the epidermis, which is the top layer of your skin. There's the dermis, which is the middle layer, and then you've got the subcutaneous layer where the blood vessels are and where the nerves are. And with the older techniques, again, which is what the other clinics worldwide use, there is a higher risk of trauma and more blood.
What I'm amazed here is the speed. I mean, they've got this going with such amazing accuracy, loading in, you know...
It's precision, and
absolutely.
it's precision surgery. And as you can see, if you notice the patient and his gesture, and he's probably watching some TV right now, and he's probably watching Emmerdale or whatever else comes on during the day. And he's talking to the surgeon as well, so great.
Okay, well, fantastic. Well, again, I think our patient has been very good to let us watch him. So, amazing video. How about a quick round of applause for our fantastic Dr. Bagassi here.
Thank you very much.
Wonderful. Fantastic to watch. So for somebody who was a little bit nervous about this procedure, having seen that, which I can't imagine anybody would, but if someone is still a bit nervous, what would you say to them?
Talk to the hundreds of thousands of patients who have had this procedure done. And we actually have a list of patients that are happy, like myself, who's had the procedure done, to talk to other patients. Some patients want full confidence, and we absolutely respect that. And those patients that don't want their surgeries shared or their experiences shared, we have a private clinic that we run, and no one knows about it. And it comes with the data protection and confidentiality.
And it's amazing, though, isn't it, today? People seem far more public about it and quite open. I noticed you had a few celebrities there who've been quite happy to endorse it.
Yes, Phil Tufnell one. There are so many other celebrities that are having the DHI treatments done. Bollywood stars are very common in having the DHI treatments done. And it goes without saying that it's more of a fashion statement now, where you've had the surgery done. Just like a lady shows off her new Chanel handbag or her Jimmy Choos. For men, it's something that we can invest in for your confidence, and it's something to be proud of.
And thinking about people who have had it done, the effects to their confidence, you must have seen some amazing stories.
And the good thing about my profession is that I get to see a patient for the long term. And I see the patients often before they've had any treatment done. any dental, facial or hair treatments done. And I can see the way that they've progressed in their lives and how successful they've become, not only in their profession, but through their social lives as well. And it gives me great pleasure.
Well, it's certainly fantastic to watch, and it's been, I think for a lot of people, it's probably put their fears at rest, thinking actually it really isn't that complicated and that's difficult.
I'm very glad. I'm very glad.
That's certainly what this live surgery is all about, so we can actually
Yes.
effectively show people how simple and straightforward it is.
And it is, it is.
Well, fantastic. Continue with the fantastic work, and thank you so much indeed for coming in.
Thank you very much.
Well, there you have it. As we said, another successful hair transplant surgery. And although I'm rather thankful I don't need the surgery, well, not quite yet anyway, it's comforting to know that there are, of course, specialist clinics such as the Synergy Hair Transplant Clinic who are actually there to help you if you do suffer from hair loss. And as you saw, it took a lot of patience and precision to be able to really carry out this hair transplant surgery. But I'm sure, as you will agree, it's very reassuring to know that you're in capable hands of experts who are there to help you every step of the way. Well, that brings us to the end of our Health Show live surgery for this particular episode. A huge thank you to Dr. Zuba Bagassi and also all of his team from Synergy Hair Transplant Clinic for guiding us through the surgery. And as always, thank you to our studio audience and to all of you at home for watching. And if you do have any questions about tonight's show, please do get in touch, and you can do that healthshow@islamchannel.tv. Until next time, thank you again for watching. Good night and assalamu alaikum.